Welcome. Today we're going to be discussing HPV. HPV is the human papillomavirus, and we're going to talk all about it during my presentation. So what is it? HPV is the human papillomavirus and is most commonly, in the United States, the most common sexual transmitted infection. There's more than 100 types of this type of virus, but 40 of them are the ones that actually cause symptoms that concern our presentation today. It is a double-stranded DNA. It's non-enveloped, so it does not have an outer casing, which makes it more dangerous to those that actually get it. It does belong to the family of the papillaviruses, and the transmission is sexually transmitted, so it could be oral, could be vaginal, could be anal. That particular thing, like I said, it's not encased, so once it does get into the basal cells, it becomes like an overgrowth, and that's where it attacks the body. The cofactors include smoking and oral contraceptives. A couple of facts I wanted to point out to you. Like I stated, of those 40, specifically we're talking about 16, 18, 31, and 45. Most of them all can infect the human mucosal tissue, but those specific ones, again, 16, 18, 31, and 45, are the ones that give you a higher risk of developing some form of cancer, typically cervical or any of the anal, genital, or penile cancers. It's more the people that do develop cancers are the ones that are immunocompromised or have some other issues, and their body just wasn't able to fight off the viruses initially. With that being said, the particular virus, HPV, there's so many forms and types of HPV that your body can actually fight it off, and a lot of times it does. It's when it doesn't that it becomes an issue in the long run. The prevalence of genital infection with any HPV type was 42.5% among United States adults aged 18 and 59 years old, and that was during 2013-2014. The incidence of HPV-associated oral pharyngeal cancer has increased during the past 20 years. And then some investigators that have been looking into this, and it's becoming more popular, they're basically saying upon initial infection, it typically takes anywhere from 10 to 20 years for the virus to actually become a tumor. So a lot of people don't realize that this particular virus is asymptomatic. So a lot of people don't even know that they're carriers as they're attempting or actually engaging in sexual activity. And I say high-grade lesions are a symptom, but not all of those actually lead to cancers. There's two huge types that they're broken up into two categories. One is the low risk, which is non-cancerous. They're typically benign genital warts, as we said, or lesions. And then those mostly deal with 6 and 11, and they cause about 90% of the genital warts that we see. The most or high risk serology or type 2, the second type or category is 16 and 18, and those cause about 70% of cervical cancer, and they're the prerequisite for the development of cervical intraepithelial neoplasia, lesion, and invasive cervical cancers. Most of the high-risk ones, they do cause some type of abnormal cell activity or changes to the body. As far as symptoms go, I want to be very realistic so you can see as bad as it can get. It can get worse than this, but these were very good pictures. But up at the top, those are anal warts. Then we have vaginal warts, and then we have, as they stated, some of them can grow as like cauliflower. So we have male genital area over here. Like I said before, a lot of times people don't have symptoms, or they've been infected years ago and never got the symptoms. But once they do get it, a lot of it is the genital warts, and they can be soft, skin colored, whitish. Some are described as burgundy in color. And they typically are, they can be flat, they can be large like those, but The bothersome ones are those, and they don't have a lot of pain, so I'm assuming that's why a lot of people kind of don't get themselves checked out for this type of thing, and they allow them to grow so big. And they can be transmitted during childbirth, so the baby can get it. And sometimes you do have some people do have some itching with it, but most times it's not very painful. Another tidbit, we have the anal genital warts. I just have a chart here basically between females and males showing the trends between the 2006-2014, and these are for ages 15 to 39 years of age. So there was a trend where it was going up and then it's trending down, but in the males, it's still kind of going upward. Women are a little bit better, but the men are still going upward. But the age group, the 15 to 19, it kind of raised a little bit, but it has declined and stayed at that level. So diagnostics. There's not a whole lot of tests that'll tell you whether you have it or not. The main thing is a visual examination of the genital area for those warts, as stated. Now, if the warts are present, they do like to go ahead and they'll do a pap test and a DNA test and the solution test. And they're looking to see if you have the genital warts, if you have any other types of warts that they need to be concerned of. Again, these types of, depending on what type of HPV you have, can be indicative or indicative of certain forms of cancer. So, treatment. There is no treatment for HPV. Once you have it, they're basically trying to treat some of the symptoms that you have. The genital warts themselves, typically they kind of go away on their own, so there's not a lot to do with those. But as you saw, the ones with the larger ones, they can be basically, there's some creams you can use, there's some other medications you can use to help them go, but it doesn't mean that they won't come back. They also have some surgical procedures. Sometimes they get them frozen off and they'll come to the operating room and have them surgically removed just because they're bothersome or where they're located. One other thing I didn't mention was that some of these locations that I showed you, their warts can develop anywhere. So even though you have genital warts, those warts can also be in your mouth, tonsils, throat. They have some on the feet, so they kind of go all over the place, okay? And quickly I'm going to go over my case study. And what we have is Andrew is a 34-year-old woman who comes in stating that she wants to get checked out because Jonathan, her sex partner, has small, solid bumps on the skin of the shaft of his penis. Jonathan told her that he was diagnosed and treated for genital warts about a year ago, and his healthcare provider told him they could reoccur. So as she came in, we went ahead and we did a full history on her. She had no previous history of any STDs, and all her previous pap smears came back negative. Her most recent one was 4 months ago, and she's actually been with Jonathan again 8 months. So she's been with him during the last pap smear, and she was fine at that point. She was she started being sexually active at the age of 16, sleeping with only men, and she's had a total of 7 partners throughout her lifetime. She does use oral contraceptives as well. So upon her physical exam, her vital signs are there. Blood pressure was 96/74, pulse was 78, respiration's 13, and her temperature was 37.1. So clinically, she's looking fine. Her pelvic exam was normal, so was her other body organs as well. But upon visually looking at her, she did have some multiple small flesh-colored papular lesions in the perineal area. Again, she appeared visually. She's been diagnosed with those genital warts. So they did go ahead and run some other labs testing for her non-reactiveness to her RPR, which is the syphilis, the chlamydia, gonorrhea, and then the HIV antibody test. So her treatment, she was offered her own, these types of creams that would have been prescribed and she would have applied to herself. There's also the provider administered therapies. Again, there's the cryotherapy. They could do liquid nitrogen to remove them. There's a couple different other options they could use, or she can choose to do no intervention. As I stated before, a lot of times the warts go away on their own. She actually did choose to do the provider-administered therapy, and then she was offered to do a follow-up reevaluation in 3 months just to make sure there was no reoccurrence, and she refused to come back for that because there was no reoccurrence for her. So, in clinical practice, just kind of going along on this, what would we do to kind of help with the prevention of HPV? As I stated, there's no treatment for HPV, but there are vaccinations out there. And I don't know if you watch a lot of TV. Typically, we don't have a lot of time to do that while we're in school. However, more recently, there have been a lot of commercials about these kids who are grown now and have been diagnosed with certain type of cervical cancers, anal cancer, different types of cancers that could have been prevented at a younger age. When I say a younger age, you're recommending that we give the vaccines to these young people starting at the age of 11. It comes in 3 doses. Currently, there's 2 different types of vaccines that are available, and they can be used in males and females. But the controversy is that a lot of parents don't want to give their children these vaccines because in their minds it might be promoting sexual activity. However, this is actually going to help them in the long run, whether they have one partner or 85. We know at some point they may become sexually active. So the thing is, we need to be able to educate our patients, our parents, and anyone in the community about these different HPV, because these viruses can be very lethal. No one should have to go through something that they could have possibly prevented. And the vaccine, a lot of it's a part of the education. If you don't know or you assume certain things, then you won't have the correct information. It's our responsibility to give them the facts or point them in the correct way or to the right sources where they can be more further educated so that they can give their young children these things. So again, I was stating that they recommend that the vaccine starts at the age of 11 for both boys and girls. And then it's a 3 doses of the vaccine over a course of 6 months. If they were to do that, and refreshing your memory, it can take 10 to 20 years after the very first infection. So if they're doing it prior to sexual activity, which is the goal, to get these vaccines before sexual activity, then their risk of these different types of cancers will be reduced. So I did have some further information. If you wanted to look more into, these are a couple sources that we can direct our patients and their parents to if they want to find out more and be further educated with the facts and not hearsay. So we have the CDC, we have the Mayo Clinic, we have HPV.com. Some people will say they don't want to go to the actual vaccines websites because they feel like they're only going to sell it and not give them the truth. But these types of, the CDC is not going to tell you a lie. So I hope you enjoyed and I hope you learned something. Any questions, just let me know.